So we have here today with us Dr. Ivy Peltz and Dr. Eric Studley from Doccupations. So Dr. Ivy Peltz is both a successful dentist with a private practice in New York City and a respected dental school educator with over 20 years of experience. Through her dual career path, Dr. Peltz has gained a vital understanding of the complexities of employment in the dental community and how to help new and established dental professionals who wish to further their careers. She's also a clinical associate professor at NYU College of Dentistry. So Dr. Eric Studley has had a long, diverse career in the dental profession and assists dental professionals with the challenges of employment and building successful careers on a daily basis. Dr. Studley owns an insurance firm which specializes in the planning needs of other dentists and healthcare professionals. He adds to his unique understanding of what dentists need to know by mentoring dental students as a clinical associate professor, also at NYU College of Dentistry. So I would like to thank you both for being here tonight, and I will turn it over to you.
Well, it is our pleasure. I do want to clarify before we start that we both retired from teaching at NYU
2 years ago.
in 2018. But we still, what teacher at heart, I guess we don't know when to stop. So
Right.
we still keep doing it anyway. That's the situation. So before we do get started with how to handle a dissatisfied patient, I did mean to ask those of you who were on and talking to us if any of you have had dissatisfied patients yet.
If you haven't treated enough.
True. But I do want to mention that Dr. Eric S. Studley and Associates, Inc. is sponsoring free memberships in Doccupations. So please go to www.doccupations.com and use promo code, it's all capitals, ESS Cares, ESSCARES at checkout for your free membership. So I think we should begin. And the way we want to start talking about how to handle a dissatisfied patient is to begin with how to keep them from becoming dissatisfied in the first place.
Right. And then we don't have to do the rest of the presentation.
Right.
So, as you are all, a lot of you are in clinic and you're seeing, patients. It's still a limited amount of patients, and you do have that great, building around you and all the supervision and, all the help that you need when it comes to, treating your patients. Unfortunately, patients aren't always satisfied. And that really starts with the moment that you meet a new patient. Or even an emergency patient, because people are reacting different ways. And patients will come in, and especially nowadays, I see so many of my students are on these commercials for all these, implant centers, these dental centers. And there's, one day they show you the commercial, you walk out with a full set of teeth. So people, come into the, their dentist, and they have expectations that, they're going to walk out looking like a certain way or within a certain time frame. And unfortunately, patients that have certain levels of expectations that are not aware of what we could actually do end up becoming that dissatisfied patient. So it's really up to you, the practitioner, to educate the patient from the first visit. And if it takes 2 visits or 3 visits, especially if it's going to be a comprehensive case or an aesthetic case, and we'll talk about, how those cases start out beautiful and sometimes just go awry. You really have to spell out for the patient their expectations with wax-ups, with photos, and you have to really limit, with the examples. I remember there was a dentist that was involved in the patient's expectations of what she wanted her teeth to look like. She chose from the dentist's waiting room.
Mm-hmm.
And it was a picture of all these beautiful, magnificent smiles. Well, these smiles were also attached to these models that were also half the patient's age.
So a lot of times, patients will come in with expectations that you, as the practitioner, understand cannot be met. And when that happens, you need to let them know from the very beginning. You started off saying your job is to educate the patient. And, they say a little knowledge is a dangerous thing. So a lot of patients now come in with a little bit of
Or
knowledge.
too much knowledge.
Yeah, or too much knowledge. But often it's just enough to know that, they want an implant. I've had patients ask me if I could extract these. This actually was a friend of mine, an intelligent person. Could I extract all of his teeth and put in implants because he didn't like the way his teeth looked? And he wasn't kidding around or anything. And there was nothing wrong with his teeth except a little chipping and so on. People don't understand what's entailed in doing the dentistry that they want done. So before you start, you need to make sure that they understand that there are going to be uncomfortable weeks, that their mouth might actually get a little worse before it starts to get better. There's a host of things that you can tell them, not to scare them off. You don't want to do that. You'll reassure them that you're going to be there every step of the way, and that if anything goes wrong, here's your cell phone number and you're available. But you have to give them realistic expectations. And the most frequent time that patients are dissatisfied is when they expected something that is not what they got. That's a matter of communication.
So one of the things that, because we live in, unfortunately, a litigious society, and this is always a good time for us to put in our disclaimer,
Oh, yes.
that everything that Dr. Peltz and myself, Dr. Studley, are talking about are the views of ourselves. And we always recommend that you do your research and also find the proper advisors, whether it's an attorney, a practice, an attorney, a CPA, an insurance advisor, a property and casualty advisor, a banker. These are all the people that you should build in your advisory team, and you should always reach out to them before you make any of these big decisions. So one of the things that is highly recommended, and dentists always say, well, if I'm doing a big comprehensive case, I'll have something in writing and that, and I say, for any treatment plan that you're doing, if it's a recare visit and the patient will be coming back, for that visit, they should have what their next visit is going to be, or the extent of the treatment plan, the total cost, and also an approximate length of time, which we could never, unfortunately, we'd love to say this could take, 3 months, 4 months, 6 months. This is also medicine. And sometimes things happen that, we might have to wait for healing a little bit longer for something. So you don't want to be really pigeoned into an exact time frame. But you want to be able to at least give the patient, a reasonable expectation. Why as well? Because if the patient is paying this out, so they're making payments, you've done, a payment plan for the patient, and they're giving you X amount of dollars towards the treatment plan every visit. If you can spell that out for the patient so that they know what they're responsible for at each visit, you will also not have a dissatisfied patient, because most dissatisfied patients usually still have a balance owed to the dentist for services that they've already rendered.
What a coincidence.
So they owe you money,
think about that.
and now they're not happy.
Right. That is, so I hope you all understand what we're implying there.
So that's
That
why
part of the
right.
reason they're unhappy is they owe you money, and they don't want to pay the rest of it. So what do? They find something that they're not so happy about, and it becomes a bargaining chip for them. So then, because we do live in a litigious society, and a lot of patients, unfortunately, are hoping to win the dental lottery. So they will take your fine work and they will analyze it until they can find something that makes them unhappy and then say, well, I'm not going to pay you the rest of the money that I owe you. So that is why it's not a coincidence that most dissatisfied patients have a balance.
So, by having that written agreement about the treatment plan, um, about the financial contractual agreement that the patient will have to pay for these procedures, um, as well as any consent that is needed. And now there are consent forms for every procedure that we do. So just having a patient sign that one consent form, when they first come into your office, um, is really not enough. So there are consent forms for every procedure.
We hope you're using them at your schools.
So it's just
But
something, and
if
if
not-
not, then, when you go into your own practices, it's just something, once again, that you should have.
And you can find some standard forms. I think the ADA has them.
Right. And I always recommend going to the ADA to get the forms because
Right.
they're standard then for us.
Right.
Another important thing that happens is, as dentists, a patient might say to us, what, Dr. Peltz, I'm going to pay you, thousands of dollars for my teeth. How long are they going to last? And, everybody's into, what's my guarantee? And as dentists, we can't give a guarantee. Physicians, they can't give a guarantee. So as dentists, because we also don't know what you're going to do with, the teeth that we placed.
Right. There's only so much that we're responsible
Right.
for as dentists. And then unfortunately, the rest is up to the patient. So if you happen to have a non-compliant patient and you've made a guarantee and now they're not doing their job on their home care, you're not going to be able to live up to your guarantee without losing money.
So really try to stay out of a guarantee, but you can, and hopefully this is not the first time, but you should be instilling this kind of trust that with you and your patient, and then the patient will feel that, what, doc, I stand behind the treatment that I do with my patients.
Is there a legal way to ensure this or to limit your guarantees? You mean, I'm not clear on exactly what you mean. Do you mean to ensure that you're only responsible for your part of the dentistry, and that if your patient is non-compliant, that comes into consideration? Because if so, then no.
Right. But
It's all on you.
Right. But that could also be in that contractual agreement that you have with the patient, and not making this into a risk management course. But that is also spelled out that the patient will take care and do what their responsibilities are,
Mm-hmm.
because you, as the practitioner, you will take care and do your responsibilities.
Mm-hmm.
So there is a way, and I know orthodontists that with children, that when they see them, after the braces are put on and they're not taking care of their teeth, a lot of them will take the braces off.
Mm-hmm. Right.
Until the kid gets back into compliance.
True.
And it should be the same way if you're doing in a big aesthetic case. The patient, just comes in and the tissue is just inflamed. The case is just not going to make it.
Mm-hmm.
So, this has to be spelled out at the very beginning, because we'll explain later, it's a lot harder to back
If that's what's happening, though, you better make sure that the source of inflammation isn't your provisionals, because if that's the case, then now again, it's on you, totally on you. Like, you need to clean that up so that the patient, the gingiva could heal a little bit.
And then lastly, please have all of your proper documentation with the patient, study models, okay, radiographs, photos, mock-ups, whatever kinds of records and technology that you used to present this case to the patient. Make sure that is, part of your chart, for the remainder of, that patient's history with you. Not that this will definitely guarantee this won't happen, but it will limit. And when you talk about your exposure as a dentist, doing some of these things, the whole idea of limiting your exposure is to do everything that you can do, to prevent what could be.
Mhm.
And by doing some of these steps, and you'll be, learning about all these different things that you could do, and you'll learn also through experience what you will be able to do to prevent, certain mishaps.
So I just want to remind you all to please open your chat box, because magically messages are being sent as we speak, and you might want to take advantage of them. For
We're not
example,
doing
Dr. Studley is available at insurance@drericstudley.com for any insurance-related questions or guidance that you would like as you begin your career. So everyone's looking for mentors, and he's volunteering. I would write that down.
So,
We want to talk a little bit about conflict resolution, because when you have a dissatisfied patient, that is a conflict, and you're going to need to resolve it. So there are 5 ways to manage conflict. I'm going to name them all, and then we'll discuss each of them. They're avoidance, accommodation, forcing, compromising, and collaboration. So none of them are right and none of them are wrong. Which one you use is going to depend entirely on the situation, but you should know about all of them so that you have these tools at your disposal. So if you're in a conflict, one of the ways to deal with it is to avoid it completely. You just don't deal with it. If you're in a relationship or you have a very close friend, you may notice that you don't always agree. And if you decide to pick a fight over every little thing, you'll never be able to talk to each other. Sometimes it's just not worth it. In those cases, you might want to practice avoidance, and there would be nothing wrong with that strategy.
so this also comes into play, with that pre-dissatisfied patient. Um, so if you could, as I kind of alluded to earlier, if you could avoid the situation from happening,
Hmm.
and so often, and I remember once I had a patient come in on a recare visit, and we took some check films, and noticed that there was a slight open margin on number 5, and I was looking at that, and then I go back into the chart, and it was actually something that I had placed 6 months earlier.
Hmm.
We don't take post-op films after cementing a crown. We do our feel. It looked right. Instead of then, because the patient was fine, and it was still cleansable.
Right.
But I approached the patient and said, I know I put this crown in 6 months ago, but I'm really not happy with it. Would you mind coming next week? There's no charge. I'd like to replace it. The patient was, number one, she's like, no, you don't have to do it. It's like, no, I have to do it. Like,
Hmm.
I need to do it. And first of all, the patient stayed with me forever, referred patients like crazy. Whatever the crown cost me back then, to replace was unimportant because it was the right thing to do.
Right. That is a very good example of the right thing to do. But if you were avoiding, if in that example you decided to use avoidance as your
Right.
method
I'll
of
let it
conflict
go.
resolution, that
Patient did
means
now.
I'm going to ignore it.
Right.
That's not what you would want to do in that situation. You're talking about a different type of avoidance where you want to preempt a situation by heading it off at the pass, because you know that something might go wrong.
Mhm.
You're not happy with your own result, and you want to do something about that. But avoidance, the type of avoidance where you just don't address the problem, is a totally legitimate way to address conflict in some situations. The next one is accommodation. And accommodation is where you give in. You say, okay, it's not that important to me. It's important to you. Let's just do what you said. And again, in the right situation, absolutely nothing wrong with that.
But that's where, so, if you've done everything right beforehand,
Hmm.
because the giving in, especially, with the dissatisfied patient, giving in sometimes, all right, the patient will let you redo, but it could be 6 months of treatment all over again,
Hmm.
you know, and at a certain point, the patient, all right, I'll do it,
Right.
but then doesn't become that, happy patient, and you're not ecstatic to see that patient when you first started it.
Right. But I think a good example of accommodation as a method of conflict management might be, I know as a patient, I just had a crown delivered recently, and I was uncomfortable. And my dentist, who I trust implicitly, was 100% convinced that there was nothing wrong in any excursion. And I'm sure he was right, but it didn't feel right to me. So what did he do? He took off a little more and it felt
Mhm.
better. That's a good example of accommodation. He could have just dug in his heels and said, no, I know that this crown is perfect. There's nothing wrong with it. And I am not going to damage my perfect work by shaving off a little more. And he would have been right, but I would have been uncomfortable.
Mhm.
And instead, he accommodated. And so we were both happy.
Mhm.
The next one is forcing, which is kind of the reverse. It's when you absolutely cannot give in. Maybe it's a matter of ethics and you refuse to compromise your principles or whatever it is, you cannot give in. And in that case, the person is either going to come over to your side or the conflict will not be resolved. And that's appropriate sometimes too.
And you know what, dentists, I don't know, maybe it's just the way our training has been as compared to physicians or surgeons. Um, I know that, with a patient we comes in with, major tooth pain. And, it might take sometimes, a couple of days for it to go away.
Hmm.
Um, and the patient might actually complain, well, I was in there and it took, 3, 4 days, and they come in with a swelling and everything. Yet, you go to a surgeon and they do surgery, and, you're posed, how you feeling? Well, I'm okay. I still can't do this, but are you better than before? Yes, it's a success.
Hmm.
It's very different,
Right.
how they approach. But if you have the confidence in the treatment that you did, you don't have to be forceful with the patient in a mean kind of way,
Oh, certainly
but
not.
in a completely professional, evidence-based kind of fashion.
Well, when you're using forcing as a matter of conflict resolution, agreed that you're not being forceful about it. You're just not changing your mind. So I I try to remember to tell students that they should not give in to the desires of patients if they know that what they're asking is not the right thing to do, because students find it very hard to stand up to a patient who has very strong desires. But that would be an example of forcing,
Mhm.
where you just say, I'm not going to do that. I'm really sorry. I've said to patients, you might be able to find another dentist who will do this for you. I'm not saying it can't be done, but of course, I explain why I can't do it. But if they still want to go ahead, I'm not going to do it, because if it goes wrong, that's on me.
Right, because a
I'm the one
patient
with the
can't just say,
dental
"But I gave you
education.
permission to do that."
Exactly.
If you know that it's not really the standard of care that should be, and you do it, patient can sign anything that they want. It still doesn't, exonerate you
Right.
from doing that.
The fourth method is compromising. And a lot of people think that that's the best thing that you can hope for when there's a conflict, but it definitely isn't. And the reason is that when two people compromise, or two groups, or whatever the situation is, nobody's happy. Nobody gets what they want. It's like, you have a friend, you live on the Lower East Side and your friend lives on the Upper West Side, and you say, where do you want to meet for dinner? And you're both cozy and it's a snowy night, and you're both like, well, neither of like, it's not fair if you commute and I don't, so let's meet in the middle. Now you're both inconvenienced. What good is that? Like, what one time you go and the next time the other one goes, and one time one person gets to stay cozy and warm and not have to be inconvenienced. That's what happens in a compromise. So sometimes that is the best solution, is that nobody's really going to get what they want. Everyone has to give a little, but just keep in mind in that situation, nobody's 100% happy. So the best usually way to resolve a conflict is through collaboration. And that's where you're going to sit down with the person, discuss what's wrong, discuss what the possible solutions might be. And at the end of that, you come up with a solution that makes both of you happy. That's collaboration, something that makes sense for everybody involved. So those are the 5 types of conflict resolution. And now, in a moment, we can talk about different levels of dissatisfaction and how you can deal with them. But before we do, I want to remind you that if you're in attendance today, which anyone listening is, you can get a Starbucks $5 gift card on us. We'd like you to have a cup of coffee on us. So please fill out the form that just appeared in the chat box, and we will email you a gift card for $5 for Starbucks. And we hope you enjoy your coffee.
Just before we go into the levels of dissatisfaction, because, I've learned that as well. I just thought you were, you're just totally dissatisfied or you're not. But there really are different levels. With collaboration, it really takes a secure dentist to be able to collaborate with the patient, like not have this, huge ego
Mhm.
kind of thing. I always, look at the end result.
Right.
And if at the end everybody comes out pretty okay
Mhm.
and, didn't turn into a major situation, then, everybody could think that they won,
Right.
but I think if you look at the end result and what it could have been,
Mhm.
I think that makes a very big difference.
And this is where, oh my goodness, excuse me. This is where your communication skills come
Mhm.
in big time, because you might be preparing for war when all this patient has is a very small and
Right,
very easily fixable mistake. No, not mistake,
right.
change.
Never a mistake.
Yeah, addition, whatever you want to call it, edition, editing. um, so, don't go into the situation with your mind made up that you're on the opposite
Right.
sides of each other. You're not. You're this person's caregiver, and your job is to make sure that they are taken care of. And if they're unhappy, they're not really being well taken care of. So you need to just like remain calm and remember that you're the professional in the room. This other person is very emotionally invested in the problem. Don't let yourself get emotionally invested because it's your work. Don't get so possessive. We all can do a better job at times, and listen and find out how you can improve. So level 1 is when you just realize that the patient is dissatisfied.
Okay.
Yeah.
And so now, you find out they're dissatisfied. How are you going to start handling this? I think the most important thing, because usually the dissatisfied patient may not say it to you, the practitioner. It might be that patient calling in
Mm-hmm.
and saying that they're dissatisfied, or maybe that they were due to come in for a next step and they don't want to make another appointment, and they might tell the front desk. Um, and that's usually what will happen, as since you're in dental school. Unfortunately, most of the time you guys are the front line, so if the patient isn't satisfied for a myriad of different reasons, and it could have nothing to do with actually what you're doing, but you're sort of like, the keeper of that. Before you approach the situation with the patient, sit down, pull up all your records, and now just start to review and look at the case and look at certain things and try to reflect, recollect, actually on what is this dissatisfaction? Passing it on to somebody else to deal with it is never a good thing. You work in an office, somebody had a patient that wasn't satisfied, and all of a sudden you see that patient's now in your schedule. Um, or, you know what, we've seen this in dental school. You know, a patient isn't satisfied with one dentist, they want to switch, they go to the next, they end up with the same,
Mhm.
and it just kind of keeps going on that way. So you have to be prepared to handle this dissatisfaction, which you may not be what is the patient dissatisfied with. And as we mentioned, you might be dissatisfied that they still owe money and now they're not letting them get their, final prosthesis. Um, or,
But you're not going
you
to
know,
assume that. You're not going
right.
to
You
jump to
can't
that
assume
conclusion.
anything like that.
So you're going to self-assess. You're going to think, was there, now
Right.
you may not know what's wrong yet. You don't know what the patient's complaint is yet, but you want to become very familiar with this case because you don't want to get caught off guard with any statements or make a statement that is inaccurate. You really want to all your dots
Right.
dotted
Cross your
and you
I, cross your
dot your
T's
I's
and
and
dot
cross
your
your
I's,
T's. You want
something
to
like
make
that.
sure your ducks are in a row. That's what you want to make sure. One of those things.
Right.
So, but you want to know the case very, very well. So you want to review it. And then while you're reviewing it, you're going to probably a little nervously at this point go through the case step by step and see if there's anything you could have done differently. And if you know that there's a glaring something wrong, the open margin you were
Mhm.
talking about earlier, then you might want to preemptively, well, first you want to find out
Right.
what the problem is. Of course, if there's an open margin, you should always replace the crown. But maybe this is one of those ones that, on magnification, you can see there's like the most microscopic open margin that realistically you can never do a better job than that anyway, but the patient is having pain. You're not going to bring up the open margin in that case. You're not going to tell the patient that that's what's wrong because you don't know if that's what's wrong. If it's a well-fitting crown and you are being extremely self-critical, that's not something to bring to the patient's attention. So you want to wait and hear what is wrong before you talk about anything. But before the patient comes in, you might have some ideas of what could be wrong. That gives you a chance to think about how you might want to handle those situations if that is what the problem is.
It's also very important to not text with the patient, because and sometimes that will happen, and you start, especially if you're an associate and that's how you're replying back to the patient, off hours. They really should be going through one same system, um, but you should not be texting back and forth with any patient. Um, so if the patient does want to correspond, always make sure that they correspond through the office email, because that's number one, the professional way to do that. And it's also a way of keeping, your records, um, as well. Um, if and when you do get to see the patient, you do not want to speak to a patient over the phone who is dissatisfied and wants to, unfortunately complain about something. You schedule an appointment with the patient, not on the side, um, so that this way the patient comes in at 1 and you kind of, side book that patient. So now they've waited 30 minutes.
Now they're angrier.
Now
they're angrier than they were when they
Right.
when they first made the complaint.
Right.
So you need some dedicated time to this. And again, you need to be the professional in the room. So once when I was a group practice director at NYU, there was a commotion and a patient was extremely angry and wanted to speak to me. And I had a few overly aggressive guys in my group at the time, and they got wind of what was going on in my small little office, and they came to my office with their arms like pushing up their biceps to make them look even bigger, and 3 of them were standing there like bodyguards, and man wanted to talk to me, and he's yelling and he's cursing and there's a lot of commotion, and I asked them to leave, and they were very, very adamant that they wanted to stay. And I said, I'm going to shut the door. You stay right out there, and I promise I'll let you know if I need you. The moment I shut the door, and the whole testosterone situation got to calm down, I was able to speak to this man very quietly. He was yelling and screaming at me, and I told him that yelling and screaming was not appropriate, that I wouldn't stand for it, that I needed him to calm down, speak reasonably. And he did. He did. He was just upset that his treatment was taking so long. And I don't blame him. He was a dentist. He had no teeth, and it had been going on for over a year. So sometimes and what did I do? I said, I'm so sorry that you've been inconvenienced this way. And he was very appreciative that he had my ear. That's really all that he wanted. Sometimes that's all that a disappointed patient wants, is just for you to hear them out and understand that they weren't happy.
Right. So you have to show them understanding, empathy,
Yeah.
because that's really what they're looking for. And especially when they're coming to you, they're looking for guidance. And when you shut them down, they really, get kind of caged in and really don't know, which way to turn.
And why would you shut them down? So you mentioned ego
Right.
earlier, and that's definitely a big part. And the other part might be money. You're at opposite ends here. You want their money, they don't want to pay you. So you get a little edgy about it.
A good thing to mention that we didn't mention earlier. You also don't have to treat every patient
Yeah,
that comes to your office.
right.
All right. I know we all want to do that, but there may be a number of reasons why you might not be suited, for that patient, or that patient suited for you. It could be, your levels of expertise. So that's why you shouldn't treat that patient.
Or it could be their unrealistic expectations. Maybe you can't communicate or have them realize proper expectations. So in that case, you'd be best off saying right at the beginning, I don't think that I'm going to be able to meet your expectations. I'm afraid I can't treat you. And they may put up a fight, but this
Right.
is where you're going to have a
Right.
forceful
Oh, but I
conflict.
want you, doc. I
Right.
was referred to you. You're the dentist I've been looking
Mhm.
for my whole life.
But this would be a very good example of a way to approach a conflict forcefully, where you don't back down just because someone's begging you, because you know that it's not the right thing for you to be doing for whatever reason. So you have to listen to your gut. Most of the cases of dissatisfied patients we hear are, the practitioner will tell you, I didn't want to, there was something about it right from the beginning that told me not to take this case. So don't.
Right.
So simple. Just don't.
It's a tough lesson for a young practitioner to
Yeah.
learn, because you don't have that experience.
hmm
But I always say, after a while, you get that experience, and you would see, and you get that little something on the back of your neck. And it just kind of gives you that sign like, yeah, listen to something. And you know what? You decide not to, and you'll actually feel better
Yeah.
that you didn't treat that patient. Like, because then you'll go over in your head everything that could have gone wrong prior to anything happening.
hmm
And you'll say, you know what? This was a good one, you know?
Yeah. Unfortunately, this is one of those things that probably you can only learn from experience. So just make it a small one, If you're
Right.
going to have to do something that your gut is telling you not to do, don't take on a giant case.
Right.
Make it a tiny little one. So you realize your patient's dissatisfied, you've reassessed, you've reflected, you've communicated with the patient in person, you were calm, you handled it well, you found out why they were dissatisfied, you showed understanding and empathy, and you find out what can satisfy this patient. And if you can satisfy them, just do it. That's it. End of conflict.
If it's realistic.
Yeah, now they're satisfied. So if not, you can think alternative or the collaborative type of approach comes in, where you hopefully can come to some kind of mutually agreeable solution. And once again, the patient's satisfied. Your goal is to satisfy this patient. And then, as we mentioned, you're going to also figure out if this might be about money so that you can just inform the way that you're behaving about it. But if you go through all of that and the patient is not dissatisfied, you're at level 2 where you have now realized that you have a patient that you cannot satisfy.
So that now becomes, and especially if that's why I always say it shouldn't be in an operatory when you are speaking with that dissatisfied patient. It is better when it's in your office, because it just seems a little bit calmer.
But you want someone in there with you,
Always,
not alone.
always. So, now sometimes, you just can't satisfy this patient. Um, One of the best things, to do, you call your colleagues, but also call, those colleagues that are much older than you,
Senior colleagues.
that, right, you can trust, that more than likely have probably, you know, gone through something similar to this and might be able to offer you some advice. But one of the most important things that you should realize is you will have malpractice insurance, when you start practicing. And, like any insurance, everybody's always afraid to call their carriers, whether they're homeowners, their, disability, their, any of their carriers. But you also have a phenomenal advisor in your malpractice company, so that when a possible incident occurs, it doesn't hurt you to call the company and speak to and they have dentists, that are advisors there, they have attorneys, and they are more than willing to help you, because if they can actually, avoid a situation, um, that would be better for all parties involved.
And think about it, you are the customer. When you buy malpractice insurance, you're the customer. They're there to serve you. So when you have a dissatisfied patient, they're a very good resource. The attorneys know exactly what to
Right.
do. They can advise you properly. They can tell you what to record in your chart. They can tell you what to say to the patient. These are the people you should be calling. So don't be scared to call them because you have an incident. Call them because you have an incident. They're there working for you.
Um, so it's very important that if a patient is dissatisfied, and let's say you're right in the middle of the case, um, and now because of this kind of dissatisfaction, um, treatment can stop, but you can't leave the patient in a worse scenario than when they started with you. Um, so you never want to get in a situation where you're ahead of the patient as far as what they've been paying, because you're just moving to get this case done. So going back to the very beginning, where we said so often the dissatisfied patient, it's really because of money that's owed to you. So if while you're treating this patient, in order once again to avoid that, the patient has to be put on notice. Like anything else, if you lease a car and you don't make the first month's payment, the second month they're going to send you one and say, hey,
Mhm.
you owe us 2 months now. And if you start to see that now they fall behind, then limit the treatment to where they're at a very stable condition,
Mhm.
pain free, um, however they have to be temporized. But you can't just abandon the patient. You can't just stop treating the patient.
Right. But you can stop treating the patient once you've stabilized them.
Right.
So, and sometimes you have to. You have to terminate the relationship. That can be a very hard thing to do. But
Mhm.
once you have them stabilized, you may need to tell them that you no longer feel that you're a good patient, provider match.
Mhm.
That the conflict has grown too difficult to manage, and you think they need to see that.
I always like to also, because we mentioned that, use the advisors, use the companies that you pay your bills to. Um, so I had a colleague um, a specialist, and unfortunately, and it's like, one of the worst nightmares for anybody, but extracted what was supposed to be a deciduous anterior tooth, took out a permanent anterior tooth, and also was unable to reimplant it. And this was on,
That's about as bad as it
that's
gets.
about as bad as it gets, an 8-year-old child. Um, so before I spoke to this colleague, he had called all his, a lot of his, friends, people in his, and immediate peer group, and everybody is talking. Oh, just make pay the patient, see what kind of deal they can make. Just pay it. Don't tell your company. None of that. Um, Fortunately, he did call me, and my big thing is, no, you have to call the company. And it was a good thing that he did. First of all, the company helped him actually settle this um, as amicably as humanly possible. Um, he was very fortunate that the parents of the child, um, had a high level of understanding. They knew the dentist did absolutely never wanted to do anything wrong, because they had such a high level of trust with him even prior to this. And that makes a very big deal. But by also enlisting the help of the malpractice company, the way that they were able to do this, because the child's a minor, and if he would have just, done a little side kind of thing and paid this patient off, that others are saying, well, what would have happened is when the child's a minor,
Hmm.
when the child becomes an adult, the child could then start a case against the dentist, 14 years later, because maybe now the child who wouldn't have settled is not happy with,
Hmm.
what has been. But by working it through the malpractice company and doing everything right, he was really able to secure that even if something, God, forbid, should occur 14 years from now, the malpractice company then will still cover him.
Right.
Um, so
So
that's important.
you try everything, but there's a quote that says you can please some of the people all of the time, and you can please all of the people some of the time, but you can't please all of the people all of the time. So keep that in mind. And if you have a dissatisfied patient, try not to let it crush you. Just behave professionally and responsibly. We have an Amazon winner, and then we had some questions that I think we'll go through for a little while.
Sure.
And if you have more questions, please type them into the chat box. We're here until 8 and we're happy to answer anything. So the winner of our Amazon gift card is Krina Patel of Columbia University. So Krina, if you're here, please type yippee I'm here into the chat box, because you have to be here to get your $50 Amazon gift card. I also want to mention that our next webinar for your district is in 2 weeks, Monday, February 3rd. I can't believe it's February already, at 7 o'clock. So hopefully we'll see you then. Karina said yippee. Wonderful. So congratulations, everybody. All right, let's go through some questions. And if you have any more, I'm going to be just checking to see if there are any questions here. Here's our first question. If you do everything right and cement on crowns or veneers, but you have a picky patient who seems to keep wanting to adjust or change the results, where and how would you draw the line while keeping your rapport? In what situation is it necessary to eat the lab cost and make new ones?
So, dear Dr. Studley, this really goes back to, so you have a picky patient, and now you're going to be getting into this, aesthetic kind of case. That's where you do the step back. So where do you draw the line? Maybe when you first met this patient is where the first line on, because if a patient is that picky about what is actually natural to the person, imagine how much more critical they'll be for something that is now unnatural, right? Because it's something that we're putting on. Um, it's really the point where you should really become experienced knowing which patients are good candidates for these kinds of procedures so that you don't get into it. Because the worst is, yes, now you've done the case, patient's unhappy. And depending what the patient is unhappy with, because it might be something that we just, we just can't humanly do. Um, that's where redoing the case, what makes you think that now they'll be ecstatic?
Mm-hmm.
Sometimes, if it was, I spoke to someone, they did a case and there wasn't a diastema, but there was a slight little space. And, he tried to add a little composite to and it's like, you can't do that. In that case, you redo the veneers and, you know, you just absorb the cost into the office, just leading towards great patient satisfaction.
Mm-hmm. I'd like a perspective on dealing with online bad reviews on social media.
Well, first of all, don't get them. That's the first thing. But unfortunately, it happens. And in certain areas, West Coast on Yelp, that I hear more than other areas. The most important thing is not to engage with anyone on social media that is giving you a negative review. Once again, as we discussed, you're a professional. This isn't, back in high school where, somebody said something bad about you and now you're going to go back and forth and create this whole trail. The best way to really, if you see a patient of yours that is posting something negative on any of these social media platforms, you should have your office reach out to them the next day and ask if they can come in and you speak person to person and ask, or because maybe a situation that occurred, just they don't understand.
Mm-hmm.
And they're using, as most people do, using the platform, to vent their anger. If you do get a bad review, you just make sure that you flood it with really good reviews.
Well, we don't mean flood it yourself,
Right.
obviously. We mean do such great work that
right.
The rest of your patients all make that disappear with all of the great reviews that you've gotten.
Because then that'll just get buried down and down. Do not engage publicly with patients on any platforms.
We have a comment. Excellent webinar. Thank you very much. Could you please email the recording from tonight? We're not in charge of the recording. Your ASDA district reps are, and I know for a fact that they post these on their ASDA district website. So I think all you'll have to do is, I don't know how long it takes for them to post it, but wait a little while and then check it out. And you'll also see our old ones there. We've given 3 in the past to you guys. And once again, we'll be back with you in 2 weeks to discuss corporate versus private dentistry. What if a patient is being unreasonable about a refund?
Well, that's where now you got to level 2.
Yeah, it's a breakup.
It's a breakup. And that's where you have to enlist the help of your malpractice company,
Mm-hmm.
because you know where it's going to head. And the sooner that you can enlist their help, your professionals, the sooner that you'll be able to deal with this and then also move on. Because none of us like any kind of, dissatisfied patients, that are in our practice to begin with. And we strive to have every patient satisfied.
Mm-hmm.
But, having that dissatisfied patient, it just will really...
It can eat at you.
Yes, it will. It really does, because we only have the best of intentions.
Right. I want to mention one other thing about ego, because we did discuss how ego make you not so great or easy about hearing the patient's complaints. But another way that ego can get in your way is if you think you can take on a case that you can't or that you shouldn't. So we can't emphasize enough that you need to be realistic about your expectations and the patient's expectations. And if it seems like a case, the point is, especially as a young dentist, because you've done well in school, you're all very proud of yourselves, and it does take a while to realize how much you don't know yet. Don't take on cases that feel outside of your level of expertise without having some backup.
Because sometimes once you're in, it's hard to get out.
Okay. So everybody, the presentation will be posted within the hour and the website is in the chat box.
I think we had one more quick question.
We did. How do you boost patient satisfaction before delivery day? So we talked about how to keep a patient from being dissatisfied before delivery day, but how would you boost patient satisfaction? That's kind of the opposite.
Right. Well, if you have to boost their satisfaction, then you're starting to hover until level 1 kind of thing, or the idea is, why should you have to boost the patient's satisfaction?
The ways you boost the patient's level of satisfaction before delivery are everything. The best thing that you could do is knowing their expectations, but also educating them. So if you have a difficult case, don't just sit there throwing instruments on the bracket table. Calmly explain to the patient the challenge that you've encountered and why it might take a little more time. Make them understand that what you're doing isn't, it takes concentration and work and expertise, and that have them understand at every appointment that you have their best interest at heart. All of the things that you do to build your rapport with your patient are going to boost patient satisfaction. If the patient is happy with you, they're going to be much more prone to be happy with your work. If they don't like you, they're going to look for things to be unhappy about.
So I think that's all our questions, that we had for this group. If you do have any other questions,
please pass them on to us. And you should have been getting some weekly emails from us. We're going to continue in that tradition and send you more. So in any case, we'll see you in 2 weeks, and we hope you have a good night. It was
Be safe.
A pleasure to present to you today.
Yeah.